Welcome to The Global Girlfriend.
Shall we book a flight to Cusco, Peru?
Yup. All right, welcome back, everybody, to The Global Girlfriend. My name's Brianna,
And my name's Morgan.
and we are your hosts for The Global Girlfriend. We are a women's travel podcast for women who live abroad or travel extensively, and we are so glad that you have joined us today. We have a super exciting episode for you today, which is about something that we don't always love to talk about, we don't always love to experience, but it is an unfortunate necessity, and that is navigating doctors and health abroad. So we're going to get into lots of different things that can be confusing, things that are sometimes easier abroad. We're going to let you know how to find doctors, how to navigate language and cultural differences. We're going to get into all of the nuts and bolts of things like insurance. And Morgan and I have been to doctors all over the world, and we do feel like we have a few little gems and nuggets for how to just make those trips as smooth as possible. So let's get right into it. Let's talk about finding the right doctor. Morgan, how have you gone about finding a doctor abroad?
Okay, so I think there's different ways, and it also depends your situation. I know we've had a lot of doctors visits from living abroad, but there's also been times where you're just on a trip and you have to do that like impromptu doctor's visit. So there's different moments for sure, but I think a couple things that are super helpful, especially if you're living abroad, is different expat forums or different expat website or not websites, but like Facebook groups and such. I've found a lot of really helpful tips or like, hey, here's an English speaking doctor, or here's where my friend goes, or if you post something asking like some advice, it's a lot of really resourceful, helpful tips. So I think for sure, um, definitely take a look, whether you're traveling or you're an expat in a country. I definitely think you should look at those pages because you can get a lot of resources and recommendations. What are some other
Totally.
ways?
I think also if you're on like a sort of short little trip, if you're staying at a hotel, if you are staying at a hostel, like you are not the first person to get sick. And I'm sure that any sort of accommodation has given recommendations to people in the past. So find,
Yeah,
an employee, find someone who works in that country who can give you some advice. I think it's also
that's
really
a
good
good.
to sort of just kind of know what your options are before you go. No one goes on a trip assuming they're going to get sick. But I think it is good just to have a general idea of what will be available. Can you go to the public hospital as a foreign person? Are there private clinics nearby? Especially if you're going to rural areas, you should just kind of know like what your options are. You don't necessarily need like a whole big emergency plan, but I think that just sort of
Mm-hmm.
being aware will give you a sense of peace as you go about your business. And then something else that we'll get into a little bit later, but I think is also really important, is kind of your mindset about going to the doctor abroad. Something that really helps calm me down, at least, is that I have been to clinics all over the world, and to be honest, 9 out of 10 times they're nicer, faster, and more efficient than they have been in Canada. And I come from a country with great healthcare. And so I think just like know what's going on, know what's out there, and then also know that there is good quality care available all over the world.
Oh yeah, absolutely, absolutely. And even for me, like even in times when I have been at the doctor or the hospital abroad, and I've been like so frustrated, like, oh, this is so unorganized, like what's going on? And then I went back home to the US and thinking, oh my gosh, I'm back in the States, like it's gonna be so organized and great. And it was the same story. So I think that so I think don't worry, it's not too different, but there is some good quality ones everywhere. And there's
Totally.
always going to be frustrations wherever you're at.
everywhere. And something that is also quite helpful, depending on where you're from, if you're feeling nervous or if you're feeling like you might want a second opinion, there's tons of different countries that have health apps that are linked to your home country. So if you needed to speak to a nurse, I know, for example, in Ontario, there's a phone number you can call. Here in Indonesia, they have a bunch of different doctors apps where you can log
Mhm.
onto the app and talk to an Indonesian doctor if you're Indonesian. So just know what your
Mm.
country has in terms of options, because there might be a way for you if you're really feeling a little bit nervous or confused. There might be a way for you to get a second opinion from a doctor at home due to the beautiful wonders of technology these days.
Oh yeah. Oh, that's a great point. And you made me think of I've used this for like sometimes to talk to a doctor, sometimes to call my bank, different reasons. But also if you have a Google number, I've been able to use my Google phone number and been able while I'm abroad and been able to call back home in the States for certain, like I said, bank or doctor stuff. So that's always an option too. You can call in a Google number
That is
if you
such
need
a
to
good
talk.
tip. That is such a good tip. And then I think the next thing we kind of wanted to talk about was language barriers and communication tips. So Morgan and I have both been very fortunate to have received great care all over the world. Again, if you're going to a private clinic, if you have talked in the Facebook groups or the social media groups, usually people will be able to direct you to a doctor that hopefully can speak your language. But sometimes there
Hmm.
are language barriers. Sometimes there's different terms for things. So I think if you're feeling like you're having a hard time communicating, the most important thing you can do is just be honest if you don't understand. The worst thing you can do is smile and nod and then go back to your hotel and
Hmm.
realize you have a big bag of prescriptions and you still feel like crap and you don't know what to do. So you just
Yeah.
have to be really honest if you don't understand. There's ways to work through the miscommunication, but the first thing is just acknowledging, like, I'm not really sure what's going on right now. Can you help me?
Yeah. Oh, that's I think absolutely. And then also Google Translate is your friend. So do
Always.
not do not feel always don't feel awkward or like rushed or stressed to pull out your phone. Use Google Translate. I think that's really really helpful. And also I think that if there's certain symptoms you're having or certain things you're allergic to, use that on Google Translate. Look up those words like I've done before where I look up, okay, congestion, cough, um, my stomach hurts, I don't know, like different things. And so I think you can look up those things so you have them, going in your head. But also, yeah, you always have Google Translate then and there if you didn't pre write down your things in that language, just in case. I think it's really helpful to use that on your visits.
Totally. Another sort of translate thing that I have experienced is a lot of times you'll go to the doctor, you'll get the prescription, then you have to go to the pharmacist. And
Oh,
pharmacists are
yeah.
so lovely, so wonderful, so helpful. But a lot of times you're getting brands from that country where you're visiting, and the directions on the prescriptions or the directions on the over the counter medications will be in the local language. So the pharmacists have always been really wonderful about explaining what to do. For me, I love to make a little note in my phone or write down
Me too.
what it is that I'm supposed to do, because I know that when I take these three prescriptions and I look at the back, I can't actually read what they need me to do. So I just find that really taking actual physical notes from the pharmacist about what you're supposed to do if you can't read the packaging is like a super important thing to do.
Oh, yeah. I think so. I think so. And then I would say if you happen to know someone where you're at that you trust and you feel comfortable bringing them with you, I think if you're getting really stressed about the language situation where you're at, you can have the option to bring a bilingual friend that knows the language who can kind of be an advocate for you and also a translator. So if you know someone that you trust, that I think that's a great option. Or say you're in an emergency situation, there's also just nice people out there that I'm sure can help and step in with the language and be an advocate for you.
Totally. One thing actually that's happened to me recently is, so I work with students and I'm really fortunate. I get to take them on a lot of cool trips to really cool places. And a lot of times they're very remote. So I was in a very remote part of Bali with a group of students. And of course, like in my job, health and safety is the number one thing. Keeping the kids safe and healthy is like my number one priority. And we had a student who, unfortunately, I forget how it happened, but she split the bottom of her foot open like really badly. It was very obvious that she was going to need stitches. There was a lot of blood. And so we get in the car, we go to a clinic, but this is a very, very remote area. And the staff there were amazing, incredible. They didn't speak English, and this child needed treatment. And our bus driver was bilingual in both of the languages. And like, I know privacy is important and all of these things, but health and safety is the most important thing. And so I was like, hey, you mind if you just come on in this room and do the translating for us? And he was, of course, more than willing to do that. But
Oh,
I
yeah.
think, just health and safety is the number one priority, and people do want to help. So it's okay to ask for it, especially in situations where you're feeling stressed or time is of the essence.
Oh, yeah. Yeah. No, I think, yeah, that's awesome. Yeah. Okay. So, health insurance and, paying for care. Um, okay. Yeah. What is your experience with insurances?
So I mean, it's different everywhere you go, but also it's the same everywhere you go. And I know a lot of our
Hmm.
listeners are coming to us from various different life experiences. We have a lot of listeners on this podcast who take a few trips a year. We have listeners on this podcast who are living abroad, many different things. So I think the first thing you really need to do is just know what type of insurance you need. And you do need insurance. You need it. You got to have it. I think, when you and I are booking flights or whatever, sometimes I don't book the like, what if your bag gets lost, 50-pound fee or something. But when it comes to your health, like, do have health insurance, because obviously we hope nothing bad happens, but it's always a possibility. And you will be so grateful that you have some sort of insurance when you travel. So I think the first thing you need to do is know what type of insurance you need. So you kind of have three options when you are traveling or living abroad. The first one is travel insurance. And so that's for shorter trips. Usually travel insurance is good for like 30 or 90 days. And that covers kind of everything. So that is like if your flight gets canceled, if you need an emergency evacuation, if you need emergency treatment while you're abroad, your travel insurance will cover that. So definitely have that if you're going on a short trip. Then the other
Hmm.
option, and this is for the girlies and the people who are living abroad, there is global health insurance. And so that's usually sort of for longer term care. That covers things like if you have pre existing conditions, if you just need sort of general checkups, if it's not an emergency. That will sometimes cover things like maternity care if you end up having a baby abroad or something like that. It's just more comprehensive and it's long term. It is more expensive. But if you are not on the local insurance, which I'm going to talk about next, you should definitely have global health insurance. And then sometimes, if you are living abroad, or working for a foreign company or something like that, you can either qualify for the local insurance, which is the government provided assistance,
Hmm.
or your job will give you insurance that usually gives you access to things like the local hospitals and that sort of thing. So
Yeah.
it's really important to know what you're doing abroad and what insurance you need, because you really do need it.
Yeah, yeah, absolutely. And I think from my experience living abroad, the jobs that I had teaching usually provided that local insurance. So that is something that feels, secure and really nice. And then I do also think if you happen to be uninsured, it didn't work out or you didn't look into it and you didn't really think of it till you're there. I think something to keep in mind, and you can definitely research this as well, is that a lot of countries have quite affordable healthcare. And so I've done on some big trips, like travel health insurance. Like when I just went to Kilimanjaro and hiked and such, we had a travel health insurance just in case something happened. But I've also had situations, yeah, where I didn't, and like so after I stopped teaching in Albania, I didn't have health insurance in Albania, but it was still quite affordable, and I was able to do, doctor's visits, emergency. Like I stepped on a rusty nail and had to get a tetanus shot,
Mhm.
um, and it was still quite affordable. So I think look into where you're at, look into the cost of things, and also keep that in mind if because that can be an option if you happen to not get the insurance.
Yeah, that's really, really smart. And again, we sort of talked about this at the beginning. Just be very open-minded to the fact that I feel like definitely coming from Canada, and perhaps maybe even worse coming from the States, we have this idea that healthcare is very expensive and very difficult to access. But in a lot of countries, it's way more affordable than it is in our home countries, and the quality of service is quite nice actually. So
Mhm.
just keep that in mind as you are maybe feeling nervous about whatever it is that you're going through. And then also, we didn't talk about this. I don't know about this because I'm not a digital nomad, and maybe someone can chime in the comments. There are like digital nomad insurance now, which is specific for people that are traveling all around the world, working in different countries, always on the move. So definitely, if you're a digital nomad, I'm sure you know more about that than we do, but that is an option if you are considering the digital nomad lifestyle. Um,
Yeah, okay, great point.
so the hilarious moments.
Yeah.
We've been talking a lot about how, and it is, we've received great care all over the world, but there are definitely some differences. So let's address them. Let's talk about them. Let's normalize it, because I think we've all been in an experience abroad where we're not feeling our best and things are not going the way that we thought we would. Morgan, what are some of the differences that you have come to expect in
Okay.
healthcare abroad?
I have a couple stories that are coming to mind that I think will highlight some, surprises and cultural differences. Okay, so one of them is, so it was around, the global pandemic time, and I hadn't gone home to visit in a year. And so I finally went home for the week, which was really nice to see my family. And then I came back to Albania and I got COVID.
Yeah.
Classic. So I go to the hospital, get tested for COVID, and then I leave, and then I come back to get my results. And keep in mind that I am in the lobby, surrounded by people, all like a bunch of elderly people, just surrounded. And the doctor walks up to me, gives me the piece of paper, and goes, "Positive." I'm in the lobby and like surrounded by people, and you're just like, "Positive, like
Positive.
you have COVID." And I was like, "Oh my gosh!" And so I just walk out with my paper, and like I just feel like, one, they like, in other places, it probably wouldn't be the norm to like share your results in a lobby, like very informally, and also not surrounded by all these people. And so that is one story. And then another one that has come to mind is, I've noticed with doctor visits, and then even things like maybe like a massage, which is not doctor's visits, but I've noticed in different countries, they're very open to just like walking in as you're undressing. Like, I feel like in the States, it's very much like, "I'm gonna give you 5 minutes," or like, "I'm gonna do a knock. Like, please let me know if you're ready for me to come in." There, you're undressing for, like, I don't, or for like a girl doctor appointment or something, and they just waltz right in, and like, I'm like,
Or
"Whoa,
they
give
or
me a second."
they don't leave. I've had two situations on
Oh.
international doctor's visits where I have needed to derobe, and the doctor's like, "Okay, just take off all your clothes now," and they haven't even left the room, and like there's just nothing more kind of like, not shameful, but it's just so awkward to be like, "Oh, okay."
You're like, "Okay, here we go." Oh,
And
okay,
like
yeah,
obviously
so
they don't care. But yeah, that's definitely something that has been different. I have that made me think of another story that has to do with Albania in the pandemic, which is when we
Mhm,
were getting our vaccines. So how your health information is stored in organization, that's different everywhere. And I
mm.
remember we did our first vaccine in like a local high school, and then they gave us this little card, and then we had to go get our second vaccine. We bring our little card, and we go to this new location a few months later for the second vaccine. And I'm not even joking. The woman working there pulls out this like Harry Potter style ledger. It's the biggest book I've ever seen in my life, like leather bound on the front, on the back. It's like a meter, it's like a meter long. She opens it up. There's like a lot. And it was all done by hand. And like eventually they digitized it, but she was literally like flipping through this massive book to be like, "Oh, yep, there you are. You've had your vaccine." And I was just astounded because I'm like, how do you keep that? I mean, they do find a way to keep it organized. And like I said, they went on to like put it into this very sophisticated digital system. But it was just very interesting that my medical records were stored in this massive notebook. Um,
Yeah. Oh my gosh, that's shocking and like amazing.
I think another thing also that's quite different is bedside manner, I think is the term,
Mhm.
or just like directness. For
Mm.
example, like I feel like in some cultures they just, they don't sugarcoat anything. They give it to you straight, which like you do want for medical information, of course. But I had a situation where I kind of had like a strange mole on my skin, and so I wanted to get it checked, and the doctor looked at it and she was like, "Yeah, we'll take it off. Like, there's nothing wrong with it, but like, there could be something wrong with it." And I was like, "Okay, that's fine." And she just looks at me. She goes, "You're gonna have a scar." I was like, "No problem." She's like, "Well, no, but I mean, the mole is already really ugly, so the scar won't be as ugly as the mole is." And I was like,
Oh.
"Oh."
You're like, "Thank you. Thank you very
Thank you,
much."
thank you. I didn't think I looked that ugly with it, but I appreciate that you told me that it looks really ugly.
Oh my gosh. Yeah, okay. I definitely a directness that maybe we're not always used to, but you gotta soak it in.
Soak it all in. And then I think
Mhm.
also prescriptions can be quite different. I know here in Indonesia, doctors are very quick to prescribe antibiotics, which I always trust doctors. If they want me to take an antibiotic, I'm going to take it. But sometimes cultures and countries can be like super keen to give you a lot of drugs at the beginning, and then sometimes they're a little bit more conservative. So if you're feeling like, oh, I've had too many prescriptions or too many antibiotics or
Mhm.
something like that recently, that's when I would say if you're really not sure, then you can, maybe get a second opinion, but also know that just different cultures have a different relationship to modes of healing. Some are more traditional, some are more prescription based, that sort of thing. So it's different everywhere you go.
Yeah, absolutely. And I think with also just on prescriptions, um, just know that there's always, different ways. Like I feel like in the States, it's like they write it and then they send it to your pharmacy, and then you have to go give them your name and pick it up. And like the doctor had to directly refer it. But I've had experiences where like I'm somewhere and they just tell me the name of the prescription and just write it in a note in my phone, and I have to show the pharmacist, and then I have to show them like it's a text from the doctor and they're like,
Yeah.
okay, great. Or and then I've also like, depending where you are, they're either, yeah, like you said, like strict or more casual with prescriptions. So there is a prescription that I took for my skin that has to be prescribed by a doctor in the States, and I found in like multiple different countries in Europe, they're just kind of like, oh yeah, here you go, or they're just like, oh, you should have a prescription, but whatever. So there's just also a lot of different norms and like formalities, I feel like, in different places.
Totally. And also, if you're having a maybe not so serious thing, but you need medication, in a lot of different countries, pharmacists can actually provide you with medication without seeing a doctor.
Hmm.
In a lot of countries that I've been to, you can go and explain your symptoms to the pharmacist, and they can give you medication that in North America we would need to see a doctor for. So if it's not an emergency situation, you can always go and talk to the pharmacists about what it is you're experiencing. Another thing that I
Yeah.
really want to emphasize, because I know it can be very scary if you have something, like malaria or dengue or something like that, local doctors are experts in local diseases. So, for example, I mean,
Hmm.
I've brought this up before. Last year, I had a pretty bad case of dengue fever, and I am so grateful that I got dengue while I was in Indonesia, because the doctors here see it all the time. They know how to treat it. So it can feel scary sometimes if you have a disease that you
Hmm.
wouldn't normally get at home. But local doctors are experts in local diseases, and it's really, we are quite fortunate to experience that treatment from people who really know about it. Because I feel like, of course, doctors are competent everywhere, but when they're seeing things and treating things all the time, they're experts, and they can keep you safe. So it's scary, but you're in good hands.
Yeah, yeah. And also just keep in mind just to be patient. And I know that if you're not feeling great, you're sick, it's really hard just to, get super frustrated. And I don't know about y'all, but when I'm when I'm sick, like all I want is my mom. I'm just like, I wish my mom was here. And I'm like,
Yeah.
and I'm super irritable. But just, have some patience. Like you said, trust the doctors where you're at. And you'll get through it. So,
Totally. So I guess as we sort of start to think to wrap things up, I think if you are right now feeling sick, hopefully you're not, but if you ever feel sick and you know you need to go to the doctor, what you should really do is just write down all of your symptoms in
Mhm.
advance, bring a list of medications and allergies, also bring your passport. A lot of
Yeah.
clinics abroad, if it's your first time, you need to have a valid piece of ID, and they won't take things like, a North American driver's license. So bring your passport with you. Make sure you know how to pay. Are they a cash? Are they a card based sort of clinic?
Yeah.
And then for insurance purposes, but also just, in case things change or you move on and things come back, most clinics abroad will give you like a written medical report of everything that happened. So just try and get one of
Yeah.
those before you go.
Yeah, and it's nice to see it visually, and maybe we'll help you translate if you
Yeah.
need to. Okay, so closing, I mean, yeah, Bran and I have traveled and lived abroad quite a bit, have had many different sicknesses, colds, tonsillitis, dengue, so we've had a lot of experiences. So just recap, just takeaways, be prepared, ask questions. And just remember that there are going to be cultural differences, and just be open, even though you're sick and not feeling great. Just remember those things and to be open.
Totally. And yeah, I think that's like our main sort of tips for the week. We hope you never have to go to the doctors abroad, but it is inevitable. If you
Hmm.
have any hilarious stories or interesting stories or stories of hope that you want to share about your health journeys abroad, we would love to hear them. So,
Hmm.
Morgan, where can people find us on the internet to tell us all about their journeys?
Yes, yes. Okay, so you can find us on social media at The Global Girlfriend on Instagram, TikTok. We're also on Spotify and YouTube, so you can go check us out there, The Global Girlfriend. And always feel free to email us as well at theglobalgirlfriend@gmail.com. We would love to connect, love to hear your stories, the funny ones, the good ones, the tough ones. So,
Awesome. So, yeah, thank you so much for listening. We will be back next week, and we hope you all stay healthy and happy.
yes, yep, thanks for joining. Bye.
Bye.